Hello, and thank you for joining us today. My name is Kelly McCoy. I have the honor of directing patient engagement programming here at the Foundation. Today's presentation is a continuation of our Care for the Soul series, in which we offer you practical tools for complementary ways to manage your health. Today's topic is on nutrition and diets. And I would love to welcome our expert today, Kate Costello. If you were at our DC symposium, you likely had the pleasure of joining Kate's presentation on nutrition. Kate is a certified nutrition specialist, mentor, and wellness coach. So Kate, thank you so much for joining us. Just so everyone knows, we have some questions that we got from our audience, from some inquiries here at the office that Kate is going to run through for us and offer her insights. So Kate, thank you. It's so good to see you again.
Kelly, thank you. So great to see you. And hi, everyone.
Thank you. And I just wanted to do a quick aside. Kate has a wonderful methodology about nutrition, which she has shared with me before and just shared with me again. So if you don't mind.
Now, I think of myself as a realist and a generalist around nutrition. In my practice, certainly I work with people and I implement and facilitate therapeutic diets, but on the whole, my philosophy is I don't really care what you call the diet. Does it fit within a framework of nutrients and nutrient density? I think of diet as an everyday experience. It's something that we do every day, multiple times a day, until the end of time, until the end of our time. And so I think it needs to be accessible, it needs to be sustainable. And again, if you want to call it Mediterranean, if you want to call it paleo, if you want to call it something else, that's fine with me. Does it fit within the structure of what I call my 6 nutrients, nutrient density, variety, etc.? So I think the way I will answer a lot of the questions is from that perspective of what is something you can do on an everyday, very successful, very sustainable, in a very sustainable way.
And I love that. I think that's so friendly. I think it's so easy, especially for patients that are going through such medical strife and, dealing with so much in their lives already. Maybe you're on a limited income. It's so
Yeah.
easy to incorporate these things into your everyday life to help you feel better.
Yeah, absolutely. It has to have to me, it has to have an everyday quality because you have this diagnosis now, right? Like that part's not going away. So how do you integrate that and these sustainable dietary lifestyle changes? Those two things have to marry together, in my opinion. And
I agree.
sometimes that means going on and off something
Mhm.
more specific or therapeutic, but coming back to the basics always, always, always.
And I'm sure too, once you start feeling better, just from these small changes, it's something that you're going to want to continue. You're going to want to wake up and feel better and control what you can.
Yeah, that's kind of
Yeah.
how it happens, right? When
Yeah.
we feel better, we tend to like continue to do the
Mhm.
things that make us and help us continue to feel better. I think also the way I practice and the way I think about nutrition is I want people to know that they have a foundation that they can always come back to. So, that saying, when we fall off the wagon, I want people to know that to get back on the wagon is not that far away, right? These are easy enough things to focus on that you can get right back on. Next meal, next day, whatever it is, next season, whatever it is.
That's great. Just like I tell myself, one salad is not going to make me immediately healthy, just like one cheeseburger is not going to make me immediately
Correct.
healthy.
Correct. It doesn't undo that quickly, right? Now there's some nuance in that, right? Like if somebody has an allergy or a true sensitivity, then yes, like having an exposure to something can spiral some other
Sure.
things. But for the most part, yes, one cheeseburger, one whatever it is not going to undo all of your efforts. And I think that's one of our like human traps, right? Is we can get into that all or nothing kind of attitude, right? That black and white thinking. If I have the cheeseburger, it wasn't perfect. Now I'm just gonna
Yeah,
throw
right.
my
Well,
hands up and the
all
rest
caution
of
to the
it out
wind.
the window. Exactly. And I think because food is an everyday, multiple times a day thing, we have so many chances to, and so many opportunities to course correct, next meal. Okay, I'm gonna like restructure a bit. I'm gonna re-anchor whatever it is. Yeah, I think that's the beautiful part. There's so many iterations, so many different days and meals to practice this stuff.
Like
Yeah.
you said, all day, every day until the end of time.
All day, every day. Yeah, I've been thinking about this a lot of like, um, we have we have to build relationship with food and like our life and our lifestyle practices because they're with us all the time. It's not like you can't really check out of it. I mean, you can, but then, that spills over.
Right.
So I like the idea of building a relationship. And as we know, all of us are in relationship to whatever degree. It's something that is a constant evolution and ongoing. And I think food is the
I
same
love
thing
it.
as
I
other
love it.
relationships.
Well, if you're ready to jump into the questions, our first one is a great segue into what we've
Sure.
just been discussing. All right, perfect. So our first question from our audience, our viewers here is, I'm trying to keep myself healthy while on a immune suppressant. Is there such a thing as nutrition to help you keep you from getting sick?
Absolutely. So being on an immune suppressant does create a little bit of an uphill climb. However, the immune system is incredibly complex and incredibly flexible, much like us as humans. And so, and remember this, like nutrition does not spot treat, right? And so whatever you're doing for the immune system, you're doing for all the other parts of you as well. So I think the best way I can answer this is like, okay, so the question, like, what can I do to keep me healthy while on immune suppressants? The same thing that you would do every day, regardless of the immune suppressant. You might turn up the dial a little bit in some of these categories, but for the most part, they stay the same. Okay, so in my practice, I have some deal breakers, and this is for everybody, no matter what they're coming to me with, because the body works the same for everyone. So those deal breakers, and these are the areas that I would focus on if I were on an immune suppressant or not. Those deal breakers are digestion, sleep, blood sugar, and stress. These are the 4 entry points, the 4 foundational ways that you can support the global body. Because remember, nutrition does not necessarily spot treat. Digestion, for instance, they say somewhere between 70 and 80% of our immune system is in our gut. Now, obviously, GBS, CIDP, these are peripheral issues, but what's a big entry point into the body is the digestive tract, right? So balanced diet, antioxidants, certain nutrients, vitamin C, D, zinc, probiotics, hydration, limiting sugar, processed foods, all of that positively impacts your digestion, which gets you into the immune system. Next deal breaker, sleep. We all know what happens when we're underslept and what happens to our immune system, right? Like classically, we get sick after, late nights, multiple nights in a row. So sleep is crucial for the immune system. It is a high priority for everyone to practice. What are your best sleep practices? Cancel the blue light on all of your screens. Get off your screens, myself included.
Me too.
Have a regular bedtime, sleepy practices like tea or reading or meditation, stretching, candles, whatever you do to get you into that second half of the day, that sleep half of the day. Sleep is also something that doesn't cost you anything. You don't have to pay anyone in order to have better sleep. There are practices, right? There's input from you of how you structure and how you prioritize sleep, but you don't have to pay anyone to like help you with sleep. Stress, of course, we all know stress's impact on the immune system. So whatever you need to do to lower stress in your body, I will not take up time, but it is crucial that all of us have practices. One thing I talk to a lot of my clients about, and this is a metaphor essentially, but for every like one stressful thing that happens in the day, what is your anti-stress thing that you do, right? How do you kind of buy back some of your protection for the stressors in your life? Simple things, use the things that you're already doing as anti-stressors. Call a friend, write in your journal, light a candle for your dinner. Like it could be anything. You just assign that this is an anti-stress tool, right? So for every one stressor, you have an anti-stress tool. And then lastly, blood sugar. Blood sugar, huge deal breaker for the immune system, right? It can increase inflammation. It can increase your risk for infection. It can alter cytokines, increase oxidative stress, change the gut microbiome. Again, blood sugar is a huge thing that you can do, no one else included, right? Some of the things that we do for blood sugar: increase protein, meal timing, be mindful of how many carbohydrates you're eating, etc. Fiber, we'll talk more about it, I'm sure. So how do I keep my immune system healthy? Focus on those deal breakers: digestion, sleep, blood sugar, and stress.
That's perfect. And that actually also segues perfectly into our next question. Speaking of blood sugar, I am on steroids and trying to avoid weight gain and uncomfortable symptoms. Are there diet changes that I can make to help?
Yes, the same thing. A little bit of an uphill climb here. We know that steroids can increase appetite, they alter metabolism, they contribute to fluid retention, they can increase the conversion of glucose to fat, which is called lipogenesis, and they can decrease muscle mass. So if we know all of those things to be true, some ways that you can shift your dietary intake: plan and prepare your meals. The more you have things at the ready when you have a sudden increase in hunger, and those things are balanced and nutrient dense, going to go a lot better. Focus on whole foods, fruits, vegetables, whole grains, lean proteins, healthy fats, etc. You must increase your protein, right? Corticosteroids can lead to muscle catabolism, the breakdown of muscle mass, which will impact your body's metabolism over time. Also, yeah, mindful of portion sizes. Be mindful of portion sizes. Limit added sugar, refined carbs. Reduce your sodium intake. I caution sodium that comes from bags and boxes. If you are salting your food right before you eat it, my guess is you're going to use a little pinch of salt. That's not going to be the needle mover. The needle mover around sodium is bags and boxes, food from bags and boxes. Stay hydrated, have healthy snacks around, eat more frequent meals that are balanced, that have all those whole foods in them.
That's so helpful. And yeah, I guess too, the biggest impetus if you're on a steroid is sleep hygiene. So do your best. Work with your physician, try to sleep. Okay. So this one was actually one of the top asked questions in our community, which is what diet changes or supplements can I add to help with inflammation?
Yes. So I'll kind of break this down into, because I think that inflammation is not, you can impact inflammation through supplementation, but obviously there's diet and there's lifestyle practices as well. So the dietary stuff, same. Whole grains, lean proteins, healthy fats, colorful fruits and vegetables. There are some specifics that I would highlight, right? Like the omegas, the omega category is one I would highlight. There's the plant-based omegas, chia, flax, hemp. There's the animal-based omegas, which are SMASH fish. That's our acronym: sardines, mackerel, anchovy, salmon, herring, those fatty, oily fish. Those are your most anti-inflammatory, I would say, omegas. There's herbs, spices, ginger, turmeric. Those two get a lot of airtime in clinical studies and research. And you can add those to food. The way I like to think about dietary changes and inflammation is there's dials, right? So there's a daily way of eating, there's intentional ways of eating, and then there's medicinal ways of eating. So when I work with clients, you got options. Okay, so like a daily way of eating might be you have salmon a few times a week. You've got chia in your smoothie, whatever, right? Kind of once a day. Intentional is maybe you're hitting those two things or two categories multiple times a week, maybe even twice a day. And then medicinal is what it sounds like. They're in high amounts, they are frequent, they are very high quality, right? So you get to choose your own adventure with those. Okay, lifestyle, things that can impact inflammation, daily physical movement. So whatever your capacity allows, daily physical movement. Daily bowel movements, really good sign that the body is functioning and that inflammation, and these are like our best bowel movements, right? Not just like I'm going 5 times a day. No. Bristol stool chart, look at the chart. Stress reduction, connection to nature, play, love, self-love, all of those things will reduce inflammation in the body. Okay, everyone's favorite, supplements.
Everyone's favorite,
Yes. And I'm going to be very generic because I have to be. I don't know what your medications are. I don't know what your health history is.
Yeah.
I don't know what your access is. All of those are question marks, and those are all important factors in order to make supplement recommendations. Because nutrients change physiology. That's their point. But you want to know what you're looking at and what part you're changing and what that's going to impact elsewhere. So it is a more detailed conversation to have with your practitioner, your nutritionist. I think getting labs done, whether those are standard blood chemistries or functional labs, that will also help in deciding what supplements to use. Some of the supplements that people take when they're trying to reduce inflammation, fish oil, of course, we've talked about omega. Single nutrients to correct deficiencies, all your fat solubles, A, D, E, K, magnesium, alpha lipoic acid, B complex, vitamin C, zinc, selenium, calcium, iron, all the minerals, right? Herbs like turmeric, ginger, lion's mane, mushroom, all of these have been looked at in order to reduce inflammation. I want to highlight though that in order, you have to understand like what is driving inflammation in someone's physiology in order to kind of course correct that or support that with supplementation. So that is essential to know in order to start working with supplements. Please do not go out there and take every one that I just mentioned. I mentioned all of them. It is much more a dialogue, and get some labs done and work with a practitioner that may be able to interpret them in a nutritional lens, from a nutritional lens, so that you can really focus your supplement efforts.
Yes. And don't go on Amazon and just buy.
No.
Okay.
And don't go to Costco and buy your supplements.
Yeah.
They've done a lot of testing. You need to get reputable brands, which is why it's important to work with a practitioner.
Yes.
Yeah.
Very good point. Okay. So our next question is relating to nerve health and diet. So is a diet for nerve health even a thing?
Yeah, because nerves are cells, right? What does every cell need? It needs protein, amino acids, it needs fat, it needs carbohydrates, energy, it needs vitamins, minerals, and hydration, right? So every cell needs the same stuff. Remember, nutrition does not spot treat. There are certain things that are helpful for nerve health, omegas, minerals. Certain herbs have been seen to help with nerve regeneration or nerve signaling. So yes, it's a thing. And I think it's a more detailed conversation than this.
Yeah. Good answer. Thank you. Okay, so the next question, this person has developed dysphagia, so difficulty swallowing, which a lot of members of our community do experience. And this is as a result of their condition. So they want to know if there are still ways that they can maintain a healthy diet.
100%. Of course. I mean, think about a smoothie. right? We all kind of unanimously agree that smoothies can be quite healthy and quite
Hmm.
nutrient dense.
Hmm.
So absolutely. Think about baby food too, right?
Hmm.
Like, right? I mean, babies are not chewing, they're only swallowing,
Yeah.
and you got to go slow, right? While they
Yeah.
kind of orient and figure out their swallowing mechanisms. So yes, I think it's valuable to work with an integrative team, a nutritionist, an occupational therapist, speech therapist, GI, ENT, whoever it is on your team, that they can all kind of collect and co-support you. But I think there's many, many ways in which you can take food, like chicken, for instance, and break it down so that it is easier to swallow for you, for your symptoms. I did look at another area as well. Okay, so one of my favorite things to do with clients is work on their vagus nerve health,
Mm.
right? And
Yes.
so the vagus nerve is a very cool nerve, cranial nerve number 10. It does a lot in the thoracic cavity, touches every single organ in there. It also governs like our swallowing and
Mhm.
our gut-brain access and motility, all sorts of things. And so I did see a study where in rats with dysphagia after a stroke, so different reason, um, they did vagal nerve stimulation in these rats, and it improved dysphagia,
Oh, wow.
possibly because of increasing remyelination,
Mm.
increasing new blood vessels, and reducing the inflammatory response. So something there.
That's
Vagus nerve exercises,
fascinating.
look it up. There's many, many books written about it.
Yes.
Very cool stuff. Again, I mean, outside of maybe purchasing a book or someone's, little downloadable course on it, it is free exercises for you to
Hmm.
do. You don't necessarily need a vagal stimulator. You can do certain exercises, singing, breathing, gargling, that all will impact and strengthen the vagus nerve.
Wonderful. So don't
At
rule
the
yourself out.
at last year's symposium,
Hmm.
I had everyone hum, and
Yes.
humming is one of the ways to activate the vagus nerve. So free to hum.
Yes. We've used that exercise since. And
Oh,
we
I
loved it. We were
love
so
that.
inspired.
I love that. I love that so much.
And what an easy way to kick off your day or ahead of a busy meeting or, if you go to a
Absolutely. I mean,
doctor's
it's
appointment and you have jitters, something so easy to do.
yeah, and like lovely. Humming is so
Hmm.
lovely. If
Hmm.
you're ever like walking by someone who's humming, it's like feels so
That's
good.
true. That's very true.
Yeah.
All right. So our next question is about healthy weight gain. So I want
Mhm.
to gain healthy weight and muscle to help improve my condition. Do you have any tips?
Yes, certainly. So I'll talk about muscle first. You've got to increase your protein intake. You've got to support digestion, right? So when we increase nutrient intake, it's going to put more demand on the
Hmm.
digestive tract. And there's many, many things in our life, in our food, in our medications that impact our body's digestive capacity. So supporting digestion. And then as possible, strength training. That is how you put
Hmm.
muscle on the body. Putting weight on the body, similar things. Weight, whether we're talking up or down, is a bit of a numbers game. So if you want to gain weight, you need to be in a surplus of caloric intake. And there's a number of ways that you can do that. There are various shakes that you can make. There's pre-made shakes. I have lots of opinions about the quality of them, certainly. Um, and you need to be eating a caloric surplus in order to put weight on the body. My hope is that you're eating things that have anti-inflammatory ingredients in them. A lot of the commercial products can be pretty pro-inflammatory in the
Hmm.
body. So again, I think working with a nutritionist that knows some good product can help. Um, yeah,
Yeah, that sounds good. I mean, challenge could be accepted in gaining weight, but you have to make sure you're doing it in a healthy way,
absolutely. I mean, you can
mindful.
do it by eating pints of ice cream. You can also do it because it's it it's language that's like, I want to gain weight, but ideally you are gaining muscle mass
Right.
because muscle mass is a well of resources for the body. Like when the immune system is taxed, it's going to the muscle for resources. So you don't just want body weight, right? And body fat. You want there to be muscle mass. And that you've got to put calories in and then do things to the body with the body, like strength training, in order to convert that into lean muscle mass.
Right.
That is the key factor, is muscle. Muscle is the key to longevity.
Yes.
Lots of research being talked about around that right now.
Okay.
Yeah.
And then, it is possible. I know it's difficult in our community, but, physical therapists, occupational therapists, they all should have great ways that you can do practical exercise at home, not injure yourself, not overdo it.
Absolutely. Work with your team. It is so valuable to work with experts in whatever you're needing, especially in the realm of movement.
Yeah.
Absolutely. Yeah.
And then this is our last question, but it really I'm glad this is last because this is kind of a whole picture question. But developing CIDP has put me on a whole health journey. So really looking to, change your life, overhaul everything. And where can I start when it comes to nutrition? And you touched on this earlier, but I'm happy to hear you answer again.
Yes. Okay, so I think that every meal is an opportunity to start and to restart and over and over and over again. So you know my foundational six, right? Proteins, fats, carbs, vitamins, minerals, water. The more you orient all of those nutrients to your day-to-day meals, especially main meals, that will make a huge impact on your overall health and wellness. Then you've got my deal breakers: digestion, sleep, blood sugar, and stress. That's secondary to those six nutrients. So you nail those six nutrients at each meal, which I will say is a very inclusive way of thinking about food. Often people, have this idea of nutritionists that I'm going to take away everything, which sometimes I do. But before I do that, add it all. Focus on those deal breakers. How can you optimize digestion? If you are eating things that cause you digestive distress, don't do that anymore. If you have practices and patterns of impacting your sleep, shift that. Blood sugar, eat those six nutrients. Stress, reduce stress in your life. Overall, I think there are, like I mentioned before, there are daily ways of eating, intentional ways, and therapeutic ways of eating. So as you're integrating this, you can start to dial things up, right? Nail it off, then increase it to more therapeutic levels. I think something that's valuable in this is your immune system, right? This is an autoimmune condition. So your immune system is kind of your Achilles heel of your body. It's something that if you factor it into a lot of your decision-making process, things are a lot more easeful. It's like if you had a knee injury and you had your whole knee rebuilt, you wouldn't jump off of curbs. You'd probably wear a knee brace. And, you'd probably do your PT exercises at home, right? Because you want to keep walking. So it's the same thing with the immune system. Yeah, same thing with the immune system. Factor it in, start small. You can course correct every single day. Work on those foundational nutrients, work on those deal breakers. That's where to go. Create a simple plan, define your priorities and goals, and remember, this is an evolution. Food is an everyday, all day thing, so it's going to evolve over time. Where you start and where you end will not look the same. You can allow for natural progression. Focus on one thing, add the next, add the next, add the next. It's the most sustainable way I've seen it, and that I practice. I have practices too, right? Where I have to focus on one thing and let the next thing add from there. So that's how I would start my health journey.
I was muted. Okay, let me go back. So that's great. Thank you so much, Katie. That was, again, fantastic. And what an easy intro and what an easy way for patients to start incorporating this today. So maybe we challenge you after you watch this, make one small change today, right? Like you said, every meal is an opportunity. speak to your physicians, see what you could do with your interdisciplinary team to get going and making yourself feel a little bit better. But thank you so much, Kate. You're so generous
Thank
with
you.
your time with us and your expertise, and we really appreciate it. If there's any resources you'd like to include in our post-event email, Kate will send them my way. We'll make sure to get them all to you. And we hope that you, our viewers, have a wonderful day. Thank you so much for tuning in.
Thank you.